Hello, and welcome back to my channel. A lot of people often misconstrue unhappiness to be depression. Most of the time, you hear people say they are depressed because they probably had a bad week at work, a bad grade, losing a job, having an argument, or they just had breakfast, meaning a bad breakup. But clinical depression is way more than just a down feeling that changes when circumstances change. It is a medical disorder, and it won't go away just because you want it to. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called a major depressive disorder or clinical depression, it affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living. More than just about the blues, depression isn't a weakness, and you can't simply snap out of it. Depression may require long-term treatment. Most people with depression feel better with medication, psychotherapy, or both. There are different types of depression. There is persistent depressive disorder, bipolar disorder, also known as maniac depression, seasonal affective disorder, SAD, psychotic depression, peripartum, postpartum, depression, premenstrual dysphoric disorder, just to mention a few. These types of depression help us to understand that apart from the behavioral manifestations, depression also has physical manifestations inside the brain. First of all, there are changes that could be seen with the naked eye and X-ray vision. These include smaller lobes and hippocampal volumes. On a micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian rhythms or specific changes in the REM and slow-wave parts of your sleep cycle, and hormone abnormalities such as high cortisol and deregulation of thyroid hormones. The cause of depression is yet to be ascertained, as it seems to have to do with a complex interaction between genes and environment, but there is no actual diagnostics tool that could predict where or when it will show up. And because depression symptoms are intangible, it is hard to know who might look fine but is actually struggling. Although depression may occur only once during a person's life, people typically have multiple episodes of it. During these episodes, various symptoms occur most of the day and nearly every day. For many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities, such as work, school, social activities, or relationships with others. Some people may feel generally miserable or unhappy without having a clue why. According to Michelle London, depression is a cruel disease that can affect anyone. It is very easy, once the symptoms begin, for a person to slide down the black hole of depression where the symptoms spiral and feed off of each other, increasing in severity. There are different signs that can tell if you or anyone around you is clinically depressed and is in need of medical attention. Before I go into the signs, I hope you have subscribed to our channel. Click the bell icon so you can get notifications when we drop new videos. You would know you are depressed when you notice the following signs. Number 1, appetite and weight changes. Eating too much or too little can suggest the presence of depression. Some people turn to food for comfort, while others lose their appetite or eat less due to low mood. These changes in food intake can cause a person to start gaining or losing weight. Dramatic weight changes can also exacerbate depression, as they can affect a person's self-esteem. There may also be physiological factors at play. For example, there is a link between carrying excess fat and increased inflammation in the body. This, in turn, may play a role in the development or increased severity of depressive symptoms. Number 2, hopeless outlook. Major depression is a mood disorder that affects the way you feel about life in general. Having a hopeless or helpless outlook on your life is the most common symptom of depression. You keep on feeling like nothing is worth doing, feel like the world holds nothing for you and you can't even amount to something. You begin to lose all sense of positivity and dwell on the negatives. Other feelings may be worthlessness, self-hate, or inappropriate guilt. Common, recurring thoughts of depression may be vocalized as, "It's all my fault," or "What's the point?" Number 3, loss of interest. Depression can take the pleasure or enjoyment out of the things you love. A loss of interest or withdrawal from activities that you once looked forward to, sports, hobbies, or going out with friends, is yet another telltale sign of major depression. You start to notice the person withdraw from social gatherings. They would start calling in sick for work regularly, and they lose the motivation to do anything at all. Another area where you may lose interest is sex. Symptoms of major depression include a decreased sex drive and even impotence. There are several reasons that a person's libido might decrease when they have depression, including loss of interest in pleasurable activities such as sex, fatigue, and low energy levels, and low self-esteem. Number 4. Increased fatigue and sleep problems. Part of the reason you might stop doing things you enjoy is because you feel very tired. Depression often comes with a lack of energy and an overwhelming feeling of fatigue, which can be among the most debilitating symptoms of depression. This could lead to excessive sleeping. Depression is also linked with insomnia, as one might lead to the other and vice versa. They can also make each other worse. The lack of quality, restful sleep can also lead to anxiety. Also, make each other worse. Number 5. Anxiety. While depression hasn't been shown to cause anxiety, the two conditions often occur together. Symptoms of anxiety can include nervousness, restlessness, or feeling tense, feelings of danger, panic or dread, rapid heart rate, rapid breathing, increased or heavy sweating, trembling or muscle twitching, and trouble focusing or thinking clearly about anything other than the thing you're worried about. Number 6. Irritability in men. Depression can affect the sexes differently. Research shows that men with depression may have symptoms such as irritability, escapist or risky behavior, substance abuse, or misplaced anger. Men are also less likely than women to recognize depression or seek treatment for it. Number 7. Thinking about death. Depression is sometimes connected with suicide. When a person is clinically depressed, he or she might think about putting an end to life. Most times, they just want to feel something other than the feeling of emptiness and sadness they feel, and this might lead to their self-harming. People who die by suicide usually show symptoms first. Often people will talk about it or make a first attempt before succeeding in ending their life. Apart from committing suicide and hurting themselves, there is also a high chance of them hurting other people during this period. Depression causes mental instability that can leave them feeling extreme rage and bitterness. Number 8. Forced happiness. Sometimes people refer to hidden depression as smiling depression. This is because people who hide their symptoms may put on a happy face when in the company of others. However, it can be difficult to keep up this forced happiness, so the mask may slip and a person may show signs of sadness, hopelessness, or loneliness. Number 9. Loss of concentration. When a person trails off during conversations or loses their train of thought, it can indicate issues with memory and concentration, which is a common symptom of depression. A 2014 study suggests that these difficulties with concentration and focus can worsen the social impact of depression by making work life and personal relationships more challenging. Number 10. Physical pains and health disorders. Depression is a mental health condition, but it can also have physical consequences. In addition to weight changes and fatigue, other physical symptoms of hidden depression to look out for include backache, chronic pain conditions, digestive problems, headache. Research also indicates that those with major depression are more likely than those without the condition to experience arthritis, autoimmune conditions, cancer, heart disease, type 2 diabetes. Depression is a serious disorder that can take a terrible toll on you and your family if not identified and treated. It often gets worse if it is not treated, resulting in emotional, behavioral, and health problems that affect every area of your life. So check yourself thoroughly to know if you are exhibiting these signs. You can also use these to check your close friends and family to know who needs help. If you notice that you are exhibiting 5 out of the 10 signs, then you qualify for a diagnosis for depression. Seek medical help immediately. Thank you guys for watching our video, and please don't forget to subscribe to our channel. Like and share our video and click the notification bell so you never miss any videos from us. Catch you guys later.